Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. I'm your host, Michael Swartz, and today I'm with Dr. Joanna Tan, who retired in February of 2024 from family medicine in Yorba Linda, California. So, been retired about 18 months as of the time of recording. And Joanna, we're going to start with just a quick conversation about the early parts of your career, and then probably in a second episode, talk about, the last 18 months or so of your life in retirement. And
Oh,
so
sure, yes.
with that, I want to welcome you to the podcast and kind of turn it over to you to share that story about your career.
Thank you, Michael. It's great to be on your podcast, and it's just so nice to see you again. We haven't
You
seen each other for a while, so it is wonderful. It's great.
You too.
So,
And so a bit of background for the listeners too. We met each other in the coaching program, and actually now here about a year later, you'll actually be coming to visit me in La Crosse and mark off a
yeah,
couple bucket list items. So maybe we'll talk about that a bit more in the second episode too,
okay,
about the reason for the visit and how it all came
okay,
together. So yeah, bring us
okay.
back to the beginning. Maybe start with kind of high school and college and what you're good at and kind of that trajectory into becoming a physician.
Oh, sure. Um, I've been practicing medicine for 43 years, and 42 years of my life I spent in Yorba Linda practicing medicine in the same town with pretty much the same community, this quote unquote the same medical group that has transformed through the years. So it's been a nice ride. It's great. I had a great time being a physician. It has always been my calling being a physician. And we talked earlier that I, I was when I was in high school. I was toying between, I was really good in math, at least I thought I was really good in math. And I sort of like medicine too. So I thought, and in those days it's very unusual, um, for a female who would like to do something like that, but that was how I was. And so when I was 18, I had the opportunity to volunteer in the hospital. And I wore a stethoscope and a white coat, and I thought it was great. I was invited into the surgical theater. I actually get to watch surgery from up close, and I thought, oh, that's really cool. And I thought this is good. But I was very fortunate that I was admitted to MIT. And of course, at that time it still is the premier number one, the best school in mathematics in the country, in the world. So I thought, oh, well, maybe that's what I want to do. But very quickly, the first year when I was there, I found out that I really wasn't that good in math anymore compared with, all the geniuses in the world. So I was struggling when I was doing differential equation. I thought, gee, this is tough. Maybe I better find something easier to do. So I became a pre-med.
Fallback plan was medical school. Got it.
So that's how my calling came about. And so and it was confirmed because in those days it was very difficult getting into medical school. And I have no idea how it happened, but I was accepted in the first batch in my third year in medical school. I mean, third year in college. And I had to graduate. So I graduated and went to medical school. The first 2 years was really tough. It's just all rote memory of body parts and things. It was boring. I didn't enjoy it too much. But by the third and the fourth year doing my clerkship, it was wonderful. I was just at the time of my life, just, working with people, making diagnoses, and it was very relational, but yet it was very intellectual in terms of, using things that I learned the first 2 years, but putting it into practice. So I thought, I'm in the right place. I'm really in the right place. It was my calling. And I went into family medicine because during those days, pretty much all the smart kids went into family medicine because there was a need. There was a
Mm.
great need. And in those days, we respond to the calling, we respond to the needs. And so I went into family medicine, and that was the best thing I've ever done because I loved it. Because I get to learn like everything in medicine. I, you know, if I want to be a master in something, I can learn it if I want to. If it's something that I don't like, I get to stay away from it. I mean, it's just like pick and choose whatever you like to do, and you can do well in it. So it was great. I loved it. It was a fantastic journey. Residency was tough, really tough. In those days, it was just mind blowing how they mistreated us. Like every 3 nights, you don't get any sleep. Yeah, I mean, actually, you actually work through the night, and they make you do the dumbest thing, like in the middle of the night when the nurses can't start an IV, they call me up to start an IV, and I thought, I worked the whole day. You just woke me up. Why do you think I can start an IV better than you? Oh yeah, we tried it 3 times. Would you come and start this IV? Oh sure, yeah, I woke up and put some cold water in my face like I'm coming. But it was really tough. But I think those were good training. There were a time when I think every 3 weekends we have to be on call. It's like we were up from 7 a.m. in the morning. You work like nonstop until Monday night at 7 p.m. Like 3.5 days of no sleep. Actually, now thinking back, that's pretty dangerous, but I gone through it. It was, I hate to say that it was good that I went through it, but it was good that I went through it because it really prepared me very well for motherhood. So
Well,
I married, yeah.
I was going to say, let's talk about that. Okay, so I think we're at the point in the story where you're going to share a bit about Canada and that move there. Um, but really interested to dive into kind of your role as a mother in medicine too, because I think a lot of people share that story. But um, real quick, you go ahead with kind of the relationship that you developed over that time, and then we'll focus in on some of that, maternal and professional physician balance. But yeah, you go ahead.
It was tough. It was tough. I like I said, married Canadian, so I was trained in Toronto with University of Toronto. But after 3 years of the cold night, but hey, never mind, honey. Let's move back to California. I get some sun. And he didn't protest, so we moved to Southern California, where it's sunny every day. It was beautiful. So we've been here for 42 years. But when I moved to Yorba Linda, I had no idea that I loved the area. It was rural. It was I mean, the freeway was open, not like what it is now. I think the rest of the world moved here with me. But it was beautiful. It was open highway, 91, the 91 freeway. If you look it up, is the busiest nowadays, the busiest freeway in the country. But in my days, it was open, 4 lane open highway. I mean, the California dream of an open highway. It was beautiful, and we had orange groves. It's Yorba Linda. It was just the birthday of Richard Nixon, by the way. It's just beautiful. It was a beautiful country, beautiful town, beautiful everything. We still love it here. Anyway, we moved here, but little did I know that I was the first lady doctor in town. I was the first lady doctor on staff at the hospital. And I go, oh wow, it's crazy. But I have a different experience than most women. Um, like I went to MIT when it was 10%, 5 to 10% women and all men. So I felt very comfortable amount men. I felt very comfortable. And when I came in, the community, the hospital, the doctor, they just welcomed me with open arm. I mean, they treated me like they're equal. Actually, they treated me better than than the equal. So I really felt very privileged. And then Um, being the first lady doctor in town, my practice just blossomed overnight. I mean, everybody wants to see me. All the ladies, all the women, they want their daughters, they want the grandmom. I mean, they all came. So I pretty much did all the pap smear in town. I did more pap smear than any OBGYN. I can attest to that, the area. But it was good. It was good. But what came with that was that in those days women don't work. So I did not have the support system that that a lot of women have these days with daycare. Um, it was difficult. I had to find babysitters to take care of my children. Um, and early on, I had dreamed to stay in academic medicine besides just working in the community. I wanted to be affiliated with the university, to do some teaching and all that. Well, that dream was crushed with two
Hmm.
kids. So I thought, that's okay. If I can't do that in the university, I can do it in the community. I can do that in the community. That's okay. If I cannot teach in the medical school, I can teach in the community. So being a woman, I was invited everywhere. The school system wanted to invite me because I was a lady doctor. I would be a good influence with all the women students. So I was active in the community. I was a speaker on many different programs, and I went to elementary school, junior high school, high schools. And so I had a lot of exposure. So I was able to bring medicine into the community. And I pretty much grew with my children, and they play sports. So I was a soccer mom, but I was also the soccer doctor mom. And so people just love me around because if there's an injury, you've got a doctor on the field. It was great. Um, we do sport physicals. So every year I went to the different high schools and I was there doing physicals. So that with all the students, so I get to know the students, and it was great. And then my children, they were in all the different activity at school. You know, my daughter played in an orchestra, so they would go overseas to perform. Both of them were in the Science Olympiad team, and we were very fortunate because the high school that they went to, they were national champion every year, pretty much during the time when we were there. So we went to a lot of university to compete. So I was with them, and they just loved me around because I was a chaperone, I was a doctor. So I pretty much, practiced medicine um, at work and outside of work.
Well,
And
I've heard from so many of your generation of female doctors that there was a lot of pioneering going on. It was the first wave of females in physicianhood, really, and now this is the wave of folks that are now approaching retirement. But what I've heard is there were a lot of obstacles. It was the first time that people were struggling to find childcare. I've heard from others that even something as simple as maternity leave really didn't exist because it was a male-dominated field. And now but what you did along the way, Joanna, is it sounds like you also created a lot of opportunities in that space, right? Where you're now bringing that feminine element into healthcare for females, and they feel comfortable with that. And so you're doing more OB work than certified OBs. And so, from what I'm hearing in this story, you basically took kind of these challenges and created opportunities out of them, and even brought that home with you. And we're able to be not just a doctor in the healthcare system, but also in the home and in kind of the greater environment that you found yourself in. And that to me sounds like a really cool perspective on becoming a physician, and then using that as such a phenomenal gift, not only in your professional setting, but in your home setting as well.
it was, well, like I said, it was a calling. It was a calling. I was born a doctor, not knowing it, and I became a doctor, and I am a doctor, And I do not have any issue with my identity. And and even in retirement, I am still a doctor. And I'm totally okay with that. And to me, you know, I've been in the wellness, the physician wellness space for a long time, for the last over 10 years. And people talk about work-life balance. I don't know. I don't know what that means. For me, is work-life integration.
Yeah.
Yeah. And and I just integrated my work into my life. I love my work. I love my life. I love my family. It's good. I married another doctor. He loved his work. He loved the family, and both of us worked really hard. And I'm not saying that it was easy. It was difficult, but I did not feel the prejudice of being a female physician and being, a pioneer. I did not feel that. In fact, I feel that I the opportunity that I had, I may not have had the opportunity if not if not being a physician, because like I was the first, you know after my children grew up and went away, and I became an empty nester, and I thought, oh, I've got so much time, what am I going to do with my life? I mean, mind you, I was still running a full-time practice, like full-time. I have always been like one of the highest producer in my group, carry on forward, from the beginning get-go to even closer time when I retired. I've always been the highest producer, and I love that. I'm a workaholic, and I just love my work. And but if you ask my children, do they ever miss their mom because their mom is always at work, and they will tell you no. If you ask my son, did you think that your mom was working full time and neglected you, or you felt that she's not there? And he will tell you no. You have always been there. Somehow or another, I was very fortunate in my days that I was able to arrange my work hours around theirs. I went to every single one of their school play, every one of their, orchestra visits. I mean, I was there in their soccer practices. So I was very fortunate in my days that I was able to have that flexibility of hours and still put in a full-time job, but yet in the meantime, um, being there, present for my children. And so they don't feel like their mom was not there for them. So so that was good. But yet being a woman, I mean, I just feel that I was able to, I can that I was allowed to do many things. Like after my child, like going back after my children went to college, I was an empty nester. And so I thought, oh, well, maybe it's time for me to get more involved in the leadership position. So I started from the hospital. And I think it's because I was woman that I became the chair of the primary care department, because they've never had a woman before. So I thought, oh, well, now that you're here, I mean, within a year that I was on medical staff, I started with the credential committee. A year later, I was the chair of the primary care department. So I thought, oh, that's really cool. So I was involved in the medical staff leadership in the hospital, and that was fun. But then I thought there's a broader picture into medicine. I just thought that, we can move medicine and affect more lives if I can be in organized medicine.
Mm.
So I became involved in our Orange County Medical Association. I think it's because I was a minority and an Asian woman. In a few years, I was a president of the county, and I thought, really? Oh, this is cool. This is great. So I think being a woman opened a lot of opportunity. Then I thought, well, that's cool. I'm in the County Medical Association, but I'm going to try out the California Medical Association. So I went in there initially as an alternate delegate, and then I became a delegate. And then we started the medium-sized forum because I was in the medium-sized medical group. So because I think I was a woman and minority. So I got voted to be the chair of of the forum. And next thing I know, I was on the board of trustees. I I I hate to say I think that it's because I was a woman and
I
all
might
these
be.
opportunities just happened.
And
And
maybe a both and. I don't think it was that alone, but it may have helped. But at the same time, Joanna, I mean, the professionalism that you bring, the success that seems to surround you, with intentionality. I think people can see what you're doing with your life, not with just your profession, but with your family. And you've mentioned, I think in a previous conversation, it wasn't just the intellectual part of the job, but the relational part too that you really enjoyed. And when you integrate those two, the way that you show up professionally was rewarded. And again, there may have been some, gold stars on being female and a minority and just being who you are. And so it probably wasn't all of the above situation, but I want to bring you into that as well. Just knowing you and how you approach life, I think it probably was more of a both and.
yeah, I just thought that it has been the last 42 years being a physician has been just a wonderful, it was a great ride. It was great. It was from the beginning to well, I don't even say that the end because I think I'm still a doctor, you know. The fact that I don't practice clinical medicine doesn't mean that I'm not a doctor anymore. And so but it has been great. You know, the 42 years that I had in the community and building up just being friend with my patients and and being just part of their lives, you know. I mean, these people just open up their lives to you like they would never do. I mean, they come in through the door and they just pour. I mean, everything that bothers them, everything that's in their mind that they would never share with anybody, they're there to share it with me. And what a privilege. I just feel what a privilege it is and it was to have those kind of opportunity to touch lives. And I didn't realize that because I thought in those days I thought I was just doing my job until at my retirement party. And that's quite a story too, because I planned my retirement 4 years before I retired. I just thought that I thought 70 would be a good time to retire because I mean, I could just work until the end of my life if I can because I love medicine. I love practicing medicine. I love being with my patient. I love what I do. But yet in the meantime, I need to be more intentional and more realistic about it because um because the human body is not forever. And with time, our intellectual ability will decrease. Our physical, we will have physical changes. And I may not be the best for my patient. And I feel that if I were going to be practicing medicine, I need to be giving them the best. So I want to leave at my peak or close to my peak instead of leaving when people go, oh, yeah, maybe it's time for her to go. That's not good. That's not good. So I thought 70 would be a good time for me. So 4 years before that, I start planning my retirement in terms of, letting go of some of my leadership um, positions. Like I was the physician site director at our group. And so found I promoted another physician who was just wonderful, fantastic. She's great, right, to take over my role. And I was there for some time before I leave. And so, if she needs any um, help or mentorship and all that, I'm available. I was available to her. And then, so many of my, being on the board of trustee, I worked myself out of that role. And so with the California Medical Association and some of my role with the County Medical Association and all that, I sort of, cut back. And then as far as my, I have always, like I said, I will always work full time. And then I slowly cut down to, 3/4 time. Um, and that's good with me. When I retired, I was still doing 3/4 time. It was good. So I was three-quarter time for about, I think, a year and a half before I retired. So it was a very intentional move. I gave my organization 2 years leeway before I retire, let them know that in 2 years I will not be seeing patients anymore. So they knew, and they sort of go, "Oh, well, go whenever you're ready." So I go, okay. I mean, I've been just so fortunate working with a wonderful organization that allowed me that flexibility and just, trust me in terms of what I do with my staff, with my patients and all that. Um, so I was just very, very blessed. But about a year before I retired, I start telling my patient that in a year I'm leaving. So 1 year before I retired. And the reason is because many of them come in to see me for their physical every year. And so I make sure that they have somebody to go to the next year. So before they leave, I set them up with one of my colleagues whom I trust will be the best match for them. I actually match my patient with the next physician so that they know a year from now they will see Dr. So and so for their physical. Mhm.
I think as we're kind of reaching the end of your career arc, and before we get to the retirement party and maybe that last year of your career, why don't we do a quick recap and kind of look back at the career trajectory and the experiences that you had, and we'll put an end to this episode, and then let everyone know they can come back and join us for that final year of your career, and then what you've experienced here in the first 18 months of retirement in our next conversation. How does that sound?
Yeah, that sounds great.
Awesome. So going to MIT, going into mathematics, deciding, hey, this isn't necessarily the way to go, then looking at what the options were and going into medicine, moving to Canada, and then ultimately Yorba Linda, and being in practice for 42 years, Joanna. That is over 4 decades of patient care. And in that time, let's just say, taking advantage of the opportunities or making most of the opportunities of being one of the first females in medicine in your practice, working not just in the family medicine space, but also moving into, county and state level leadership as well, and really affecting probably positive change in healthcare over the course of your career and all the relationships that you built along the way, and maintaining and raising a family in the meantime. And one detail that you had shared with me too was your mom saying you get to raise these kids on your own, and kind of
Oh my goodness.
a lack of childcare and support in that time. And yet here you are championing this life path of being not only a doctor, but a mom as well. And so really, Joanna, just a career worth celebrating, which I think sets the stage for this good transition where you're still looking out for your patients 41 years into practice, doing the best for them, setting them up with relationships. And then in our next conversation, we'll talk about that last year of your career and what happened for, your retirement party, and then these first year and a half here, first few months of retirement. How does that sound?
That sounds great. That sounds great, Michael.
All right. Well, we'll see you. We'll see you in the next conversation then.
Okay, great. Looking forward to it.
Thank you. Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.